Now, the Senate has requested detailed reports from Auditor General Nancy Gathungu and the Controller of Budget, Dr. Margaret Nyakang'o, on how financial and material support received by county governments to combat the COVID-19 pandemic was utilized. In a letter penned by Senate Clerk Jeremiah Nyegenye, the committee wants the Auditor General to undertake a special audit and submit an independent report by the 4th of September. The reports are to shed light on the alleged misappropriation of the COVID-19 funds by the county governments. Here's Raquel Mugai with more.
The onset of COVID-19 pandemic in the country demanded for more resource allocation to see to it that the already struggling country's health system does not fall to its knees owing to the magnitude of the disease, a fact that saw the country receive a 5 billion shillings conditional grant from the World Bank through the Ministry of Health, funds that were to be shared among the 47 counties. However, the Senate Ad Hoc Committee on the COVID-19 situation has floated the possibility of the funds being redirected to other projects instead of the sole intended purpose. The committee, through a letter, wants the Auditor General Nancy Gathungu to undertake a special audit on the utilization of funds allocated to the 47 county governments in responding to the COVID-19 pandemic. Major issues to be addressed by the report expected by 4th September include establishing the total amount of funds received by the county governments, establishing whether the funds from the national government were spent in accordance with approved work plans, and to detect any irregularity involving the misuse of public funds and any related weaknesses in management control. The recent months have seen questions arise as to how efficient procurement of PPEs and masks is being done. The Council of Governors had requested to outsource the products from other persons, given that KEMSA was being overwhelmed. On Tuesday, officials of the Kenya Medical Supplies Agency, KEMSA, were chased away by the Senate Health Committee for failing to provide documents on alleged procurement irregularities at the medicine supplier.
We continue to urge prudence in the acquisition of these PPEs and indeed all health commodities to ensure that we deliver value to our people. And I wanted to make those remarks because obviously there has been press reports about the prices that were there before for PPEs, the prices that were there for face masks. But I would like to say that anybody doing a little research will find that that indeed was the situation across the world at that time.
While there are still questions as to whether or not the county governments did receive the 5 billion share as distributed by the Commission on Revenue Allocation, the audit by the Auditor General will shed some light on the status of the availed funds to the county governments.
Wakati ukifika, it shall be audited in broad daylight. Kila shilingi, kila dururu ambayo imetumika, Wakenya waweze kujua hii pesa ilitumika kwa njia gani na kusaidia nani.
The Controller of Budget, Dr. Margaret Nyakang'o, has also been issued with a similar letter from the committee requesting for a special budget review implementation report on utilization of funds by county governments to be received on or before 21st August. The reports will cover the period from 13th March 2020, when the first COVID-19 case in Kenya was reported, to 31st July. Raquel Mugai, Citizen TV.